start with this. You called birth control pills, and I'm going to quote, a disrespect of life. And you said Americans, quote, use birth control pills like candy. You also claimed, contrary to established science, that hormonal birth control has, quote, horrifying health risks for women. Now, here are the facts. There are 18 FDA-approved contraceptive methods, both hormonal and non-hormonal, and there are decades of evidence showing that every one of these birth control methods is safe and effective. So I wanted to ask you, help me understand, should women trust the FDA, which approved all 18 methods of birth control after a very rigorous look at the evidence, or should they trust your statement that there are horrifying health risks to birth control, which contradicts that evidence?
And when I say those comments, which are taken out of context, I'm speaking about particular women that can be hurt if there is not informed consent about their medical history, their lifestyle exposures, and their family history. I want those women, and I know you do too, to be able to have a thorough conversation with their doctor and know whether they are at higher risk for side effects when prescribed the medication.
Saying that is one thing, but saying on, different shows that birth control pills are a disrespect of life is very different.
I am passionate about women's health, and I think it is disrespectful
people use
to women.
Birth controls like candy is very different than what you just said.
Something just happened in a United States Senate confirmation hearing that practicing physicians across the country are describing as the most alarming public health moment they have witnessed in their professional careers. Not alarming because of a disease outbreak, not alarming because of a new pathogen or a healthcare system failure. Alarming because the person being confirmed to serve as the nation's doctor, the Surgeon General of the United States, the individual whose entire constitutional purpose is to communicate settled medical science clearly and accurately to 330 million Americans, could not give a straight answer about whether vaccines cause autism. A question with a definitive scientific answer supported by decades of peer-reviewed research involving hundreds of thousands of children across multiple countries. A question whose answer has been established so conclusively that the original study suggesting a connection was retracted for fraud and its author lost his medical license. A question that any first-year medical student could answer without hesitation. She hedged. Make sure you're subscribed to The John Brown Show, because what I am about to walk you through is not a story about one bad confirmation hearing performance. This is a story about what it means for public health in America when measles is already coming back, when 2 children in Louisiana died of whooping cough last year, when vaccine confidence is already declining, and the person being asked to lead the national response to all of it cannot say clearly and directly that vaccines do not cause autism. Here is the specific exchange that sent licensed physicians watching the hearing into a collective fury that is still reverberating through medical communities across the country. A senator asked directly, "Do you believe that vaccines, whether individually or collectively, contribute to autism?" The nominee's response did not include the word no. It included acknowledgement that autism rates are increasing, that the medical community does not fully understand all contributing factors, that the administration has committed funding to study environmental factors, that until there is clear understanding, we should not leave any stones unturned. Every single one of those statements is either misleading or irrelevant to the question that was asked. The question was not whether we fully understand every factor contributing to autism. The question was whether vaccines cause it. The answer is no. That answer is supported by multiple large cohort studies involving hundreds of thousands of children. It is supported by the retraction of the original fraudulent study that created the false connection. It is supported by 60-plus years of vaccine safety data. The answer is no. She did not say no. Share this video because what practicing physicians said about that moment captures exactly why it is so dangerous for someone in this specific role to give that specific non-answer. When the Surgeon General hedges on settled science, the hedge does not create nuance. It creates confusion, and confusion costs lives, not abstractly, specifically. Measles was essentially eradicated in the United States through decades of vaccination. 2 doses of the MMR vaccine are 97% effective at preventing it. Since the measles vaccine was introduced in 1963, Measles deaths in the United States declined by 99%. 99%. That is not a debate. That is not a contested finding. That is a documented public health achievement built on settled science. That achievement is currently being undone. Measles outbreaks are occurring in multiple states simultaneously. Vaccination rates are declining. And the person being confirmed to lead national public health communications just told the Senate committee that science is never settled and that we should not leave any stones unturned on the question of vaccine safety. Think about what a parent who is already uncertain about vaccines hears when the nation's doctor implies that the connection between vaccines and autism requires further study. That parent does not hear nuance. They hear confirmation of their fear. And the child who does not get vaccinated because that parent's uncertainty was amplified rather than resolved by the nation's top health communicator is the child at risk in the next outbreak. Make sure you're subscribed because the birth control exchange that preceded the vaccine moment reveals a consistent pattern that physicians are describing as institutional gaslighting on a national scale. The nominee had previously described birth control pills as a disrespect of life, had said that Americans use birth control like candy, had claimed that hormonal contraception carries horrifying health risks for women. When a senator quoted those statements back at her during the hearing, she said her words had been taken out of context, that she was speaking about informed consent, that she wants women to have thorough conversations with their doctors about risk factors. Here is what that response obscures. Birth control is one of the most studied medications in modern medical history. The FDA approved oral contraceptives in 1960. 66 years of research, monitoring, safety data, and population studies have established its safety and efficacy profile with extraordinary precision. Every medication carries risk. Every physician is trained to assess individual patient risk factors and prescribe accordingly. That is not a novel insight requiring the Surgeon General's intervention. That is what licensed physicians do every single day with every medication they prescribe. The specific risk numbers tell the story precisely. In reproductive age women not on hormonal contraceptives, the annual risk of a blood clot is approximately 5 in 10,000. On oral contraceptives, that risk rises to 3 to 9 in 10,000. In pregnancy, that risk is 10 to 30 in 10,000. In the postpartum period, it climbs higher still. The medication that the nominee described as horrifying carries a risk profile significantly lower than the alternative it prevents. Share this video because the maternal mortality data sitting behind this birth control discussion is the part of the story that transforms a policy disagreement into a life or death public health crisis. The United States has the highest maternal mortality rate among wealthy nations. 22 deaths per 100,000 live births in 2022 across the general population. For Black women, that number is nearly 50 per 100,000. Black women are 2.5 to 3 times more likely to die from pregnancy-related causes than white women in the same country with the same theoretically available healthcare system. Pregnancy in America, particularly for Black women, carries statistical mortality risk that dramatically exceeds the risk of the birth control medications being described as horrifying. And the states with the most restrictive abortion bans overlap significantly with the states with the highest maternal mortality rates, restricting access to contraceptives, undermining confidence in hormonal birth control, overturning the constitutional protection for reproductive autonomy, and simultaneously presiding over the dismantling of public health infrastructure does not reduce health risk for American women. It increases it, specifically and measurably, in the data, in the mortality statistics that are rising rather than falling. Think about what it means for this specific person to be the one communicating national health guidance in that environment. A person who describes birth control as a disrespect of life, who calls prescribing it like candy, who then retreats to context claims when the words are read back to her, who simultaneously has financial ties to supplement businesses whose products do not undergo the rigorous FDA approval process that she is casting doubt on for vaccines and contraceptives. Make sure you're subscribed because the credibility contradiction at the center of this nomination is the part that licensed physicians are having the most difficulty processing. She attended Stanford Medical School. She did not complete her residency. She does not hold an active medical license. She does not see patients. She cannot write a prescription. She cannot practice medicine in any state in the country, and the administration is nominating her to serve as the nation's doctor. The Surgeon General of the United States is the position that Americans look to for authoritative public health guidance. The person who issues advisories on smoking, opioids, social media, mental health, and every other major public health crisis that requires clear, credible communication from a trusted medical authority. The credibility of that position rests on the professional standards that give physicians the authority to speak on medical matters. Standards that include completing medical school, completing residency training, obtaining and maintaining a medical license, and building the clinical experience of actually caring for patients. Physicians who watch this hearing are not peeved about professional turf protection. They are trained professionals who understand what clinical judgment actually means and where it comes from. They know what a pulmonary embolism looks like because they have treated one. They know how to manage postpartum hemorrhaging because they have done it at 3 a.m. while exhausted and responsible. They know how to carry the grief of losing a patient because nobody teaches you that formally, and you learn it anyway in residency when you are too tired to process it and you have to show up the next day. That is what finished medical training produces. Not a credential, a capacity, a clinical judgment that cannot be built from reading studies and hosting wellness content and selling supplements. Share this video because the selective skepticism pattern that licensed physicians identified during this hearing is the precise mechanism through which public health confidence is systematically destroyed. She expressed concern about aluminum in vaccines. She questions FDA-approved pharmaceutical interventions with extensive safety data. She emphasizes uncertainty about settled scientific questions. And simultaneously, she has financial ties to supplement products that do not undergo FDA approval, do not go through randomized controlled trials, do not require the same rigorous safety and efficacy demonstration that vaccines and contraceptives must satisfy before reaching a single patient. The standard of scrutiny is being applied selectively. Interventions with decades of safety data, peer-reviewed research, and documented mortality reduction are being questioned and hedged. Products sold by businesses with which the nominee has financial relationships are not subjected to the same skepticism. That is not principled scientific inquiry. That is selective doubt being deployed in ways that benefit specific commercial interests while undermining public confidence in the interventions that have the strongest evidence base. When the Surgeon General applies selective doubt to settled science, the communities that pay first are not the wealthy communities with robust access to healthcare providers who can navigate confusion and find accurate information. The communities that pay first are Black, brown, and poor communities where the Surgeon General's public communications carry outsized weight because alternative sources of trusted medical guidance are less accessible. Think about what it means for those specific communities that the person being confirmed to serve as their top health communicator described birth control as horrifying and could not say directly that vaccines do not cause autism. Make sure you're subscribed because the areas where practicing physicians actually agree with the nominee's stated concerns reveal why the credibility problem is so damaging to the legitimate public health issues she claims to care about. Ultra-processed food is a genuine public health crisis. Metabolic disease rates are genuinely alarming. Children's mental health is in genuinely serious condition. The impact of social media on adolescent anxiety and depression is real and documented. These are issues where the public health community has been raising alarms for years and where strong Surgeon General leadership could make a meaningful difference. But credibility requires consistency. You cannot cast doubt on FDA-regulated, extensively studied, peer-reviewed interventions like vaccines and oral contraceptives while profiting from supplement products that bypass those same regulatory standards. You cannot claim to care about women's health while describing the medication that has expanded women's educational attainment, workforce participation, and reduced maternal mortality as a disrespect of life. You cannot ask to be trusted as the nation's doctor while refusing to maintain the active medical license and clinical practice that the title implies. 66 years of birth control safety data, 60 plus years of measles vaccine efficacy data, multiple large cohort studies on vaccines and autism, peer-reviewed data on maternal mortality and contraceptive access. Not what we think, not what we believe, not what we hope, what the evidence shows, what the data proves, what settled science has established. Birth control is not candy. Vaccines save lives. Pregnancy carries risk that is significantly higher than the medications being described as horrifying. And the nation's doctor is supposed to say all of that clearly, directly, and without hedging when the cameras are on and the public is listening. That is not what happened in that hearing room. And the measles outbreaks spreading across multiple states right now exist in the gap between what should have been said and what was. This story is just getting started. Stay tuned.